New Zealand has taken a step towards achieving equality through providing free dental and healthcare for certain children in our society. This step has enabled families of all income levels to receive the same basic treatment that is needed for a good quality of life. But what if some of these families are still disadvantaged? Some families struggle to actually get their children to the doctor, dentist, and hearing appointments, even when they are provided at no cost. Some of the reasons that families struggle with this are because they have limited access to transport. They have other younger children which they cannot leave alone. They cannot afford public transport, or they are immigrants and do not have a lot of knowledge of how these systems work in New Zealand. Furthermore, many parents are simply unable to take time off to take their children to these appointments, as they cannot afford to lose any of their weekly income. Our company thought that a good group to focus on in order to achieve greater equality in this area would be children in lower decile primary schools. This is because if we can make children's lives more equal at this early stage, it is likely to make things easier for them as they grow older. Undetected and untreated tooth decay can cause serious infection, loss of teeth, and expensive and mostly preventable emergency surgery. In extreme cases, its treatment can lead to serious disability. If children cannot make it to dentist, doctor, or hearing appointments, this could cause long-term damage, which would require more money to be spent, and therefore leave these children at more of a disadvantage than they already were.
Our solution is Health Drive, a company that provides transport for kids to and from their health appointments. It is a service provided to primary school children enrolled in a Decile 4 or lower school that are not making use of their free healthcare appointments in New Zealand. This will help parents who are struggling with understanding, transporting, and finding time to take their kids to the dentist. It will ensure that Kiwi kids are getting what they are entitled to and secure a healthier and brighter future for them. Furthermore, it will help create more equal access to the free health services that are available for certain children in New Zealand. In partnership with schools and local doctors, dentists, and audiology clinics, the schools will contact us in regards to which kids are not visiting these institutions, and we will then work with the school and the parents to help get the child to and from their healthcare appointments. We understand the everyday life struggles of these families, and we aim to be a flexible agency that provides pickups and drop-offs to and from school or to and from their home. The day and time will also be variable depending on when it works best with the school, the parents, and the healthcare provider. The basis of the transporting will be done by volunteers with their own cars. They will be able to sign up with our agency and be appointed to a job when it is needed.
As we are a volunteer service, by law it is not required that our drivers obtain a passenger endorsement. The New Zealand Transport Authority allows the use of only a valid full driver's licence if a vehicle is carrying less than 12 passengers, and drivers will not be paid for their service, such as for a taxi or Uber. As we are not required a P licence, it will reduce our running costs annually by around $73 per person. To ensure that our volunteers are safe, we will carry out a full driving background check and vetting at the cost of $9.70, which is only a small fee per year. The cost will be covered by our partnered doctor and dental clinics as we continue to provide them high volumes of business through making them more accessible for those in need. We want to ensure a beneficial experience for our volunteers as well. As a medical student, there is substantial competition between peers, and it is extremely hard to get an understanding of what the real-world environment will be like. It is also hard to make connections and get your name out there. By asking medical and dentistry students to volunteer, we already know they have a passion in that field. They already have a passion to help. By setting a good example as a volunteer, they are able to meet potential employers and make good connections with those already in the industry. We believe that volunteering for those in need will be helpful on a CV when applying for jobs. In order to make our business sustainable and successful, it is vital for us to keep our costs as low as possible, and can ensure this by asking the volunteers to use their own vehicles, as compared to renting or purchasing our own. By checking that all the vehicles have a current warrant of fitness and registration, we can ensure that all of our vehicles are safe and roadworthy. It also ensures flexibility, as then we have no limitations to locality or growth. We are also wanting to reward our volunteers for their time. By partnering with Caltex Petrol as a non-for-profit organisation, we will be able to provide our drivers with fuel vouchers as a big thank you for all their hard work. We are sustainable as our business has minimal cost. Any minor payments that we do endure will be covered by our partnered clinics, as we provide countless patient opportunities that would otherwise not be possible.
In future, we'd be looking to expand the service to other demographics in need of assistance, such as the disabled or the elderly. This service could benefit them tremendously, as they may also struggle to make it to their healthcare appointments.